Hello, everybody. I know a lot of people in here kind of got to know me with our our first speech, and they kind of figured out that I'm kind of an adrenaline junkie. That's why I chose to have this career path as a flight nurse. And this comes up.
Did you turn it off?
Oh, I know I did. Okay. So
Again?
I'm sure everybody has seen this at one point or another in your life. This is a helicopter responding to an accident that was motorcycle versus pickup truck. This is one reason why I chose to be a flight nurse, because my dad and my sister were involved in a motorcycle accident in 2007. Some people don't always know exactly what a flight nurse is, but it's basically, usually it's an RN that works on a helicopter. They get responded or get called up for calls and they have to respond to them, just like paramedics do in the ambulance. Usually there's both a nurse and paramedic that are on the helicopter, as well as 1 to 2 pilots, depending on how big the aircraft actually is. Flight nurses really became popular during World War II. It was started by the Women's Army Corps. Being that World War II, in order to be in the military during that time, as a female, you had to be a nurse, so it was kind of your only option. Then they figured out that people being injured in battles and all that stuff needed to be taken out to get to surgery or wherever. So they would use the women in the hospitals to climb up on the helicopters and take off and go and get those people out of there. This was the only way that women could be in war, like I said before. So kind of cool. I thought that was pretty interesting because I'm in the military. During World War II, almost 1.2 million people were transported via helicopter out of war, and only 46 out of that huge number died in route. So that's pretty good. Tells you how much our resources have grown since then. As a flight nurse, you're not only responding to the scenes of accidents in the middle of the freeway like a lot of people think it is, but you're also taking care of people who need to be transported to a specialty hospital, such as the elderly, other cancer patients, that kind of thing. You're in charge of taking care of the overall well-being of the patient, such as vital signs, tending to their wounds, administering any medications that they need. Being a flight nurse is basically working in a fast-paced emergency room or an ambulance with very high power, I guess you could say. It's not very demanding as far as the time that you're actually on the helicopter. You get 2 24-hour shifts per week, which is basically a part-time status, and you're not working that full 24 hours. You're basically on call. So that's kind of cool. It gives you plenty of time to work in an emergency room or in an intensive care unit within the area that you live, or that kind of thing. The salary that flight nurses have is actually a pretty big number, in my opinion. It's $40,000 to $90,000 a year. They make a lot of money just as a flight nurse. That's not including their side job in the ER or that kind of thing. Tim Alden is an RN. He's a flight nurse with the Rochester Mayo, and he said that the flight nursing specialty provides a level of excitement that is difficult to match in the nursing profession altogether. You don't get that kind of excitement in an actual emergency room versus working on the helicopter. Like I said before, it's an extreme amount of adrenaline, just like firefighters going to put out a fire. It's very fast-paced, and it forces you to think under pressure. So if you're not very good at that, it's probably not the right job for you. The reason I wanted to be a flight nurse, other than the adrenaline, was because I witnessed so many accidents growing up, with my dad being a paramedic and my stepmom being a nurse, and that was kind of my deciding factor. Was I want to be there. I want to help that person get from accident to the hospital or hospital to hospital. I want that person's life in my care, basically. It's kind of a lot for someone my age to think that way, but that's kind of who I am though, so that helps. But today I talked about being a flight nurse, kind of some of the things that make it up, such as the Women's Army Corps for World War II. It's not just accident scenes that you're responding to, and it's excitement and adrenaline, and you get to help people at the same time, and there are great benefits to it, so that's why I chose that. Thank you.